Good evening. My name is Karl Mallory, and I work with Mistema Information Solutions and with Cowichan Tribes, and I'm very happy and excited to be here to talk to you tonight. I want to talk to you a bit about an opportunity that I believe exists for First Nations across this country to lead some transformative change in our healthcare environment. But first, maybe a little bit of background and a little bit of context. I'm sure we've all seen over the past months and years articles in our newspapers that speak to problems and challenges within First Nations communities with respect to healthcare. Now, I'm not suggesting at all that these problems don't exist or that they don't warrant our attention or that we shouldn't be doing something about them. My challenge with some of these articles is that, not unlike a lot of news we see, it's deficit-based, problem-focused. And based on my experience working with a lot of First Nations communities across this country, I don't think it really speaks to some of the strengths that I've seen in some of these communities, especially in their healthcare models. Also, I don't think these articles, not that they're intended to, but they don't really build a sense of understanding about the healthcare system on reserve and how different it might be from what most of us would experience when interacting with provincial services. I've been fortunate enough in the past decade or so to spend quite a bit of time working with First Nations directly, on reserve, in the health centers, and I've had a chance to really learn and listen to what's going on in these health centers. Long ago, I was asked to basically just go out and listen. If I wanted to actually work in this environment and try to do something meaningful, I should go out and learn what's actually going on. And I need to do that by sitting down, maybe having a cup of tea with the health director and the nurses, and actually gaining an appreciation for how they're delivering care and what kind of challenges they have before them. So I did that, and I've been across the country to many, many health centers. I've been to big health centers. I've been to some really small health centers. I've also discovered an appreciation for how heavy a truck can be in the middle of winter when it breaks down on a logging road in northern BC. And I have, unfortunately, flown in some pretty terrifying little planes to get into some very beautiful communities, but they're hard to access. And what that's also helped me understand is that they can be hard to get out of when there's a health emergency or when you're seeking care that may not be provided within the health center that you have available to you. Invariably, though, what I have seen is a very dedicated group of health professionals working in these health centers in a very coordinated manner with their community's best interests and priorities at the top of their mind. They're often working in situations where they don't have enough capacity. Their funding models can be confusing and hard to interpret. And of course, there can be challenges accessing the kind of specialties or capacity or specialists that they need. But let me ask a question. How many people have been to a First Nations health center? Good. So those of you who have will understand that the care model there is not fee-for-service. It is not based on primary care or acute care. It's mostly based around community health, public health, prevention, and promotion. But what's most interesting to me is that these services are provided in a very holistic and integrated manner. There's a high degree of coordination within these health centers, and at the center of the service model is the patient, the family, and the community. And the providers there are doing everything they can with limited resources and usually without any health information management technology at their disposal to deliver these care services. Cowichan Tribes is the largest First Nation in BC, and I've had the good fortune to work with them for close to a decade now. They have been early leaders in the adoption of health information technology that is focused on supporting the First Nations care model. They're also guided by a set of teachings that are delivered by their elders, and these teachings really permeate everything that's done in the community, particularly in the health environment. I've been fortunate enough to have these teachings conveyed to me, and some of them really resonate with me, particularly in the context of health. This one in particular, going back to what I was saying earlier about the care model and the patient being at the center. But the other one that's interesting, and I think very important and timely, is this concept that each person has a responsibility for their health. I think that's probably more broadly applicable than just in a First Nations context, in fact. To me, it conveys that we all have some sense of obligation to take care of our health, to make good decisions, to advocate for ourselves. Well, the folks at Cowichan Tribes really understood this and agreed that if to do this properly, we have to give the patients tools. How about 21st century tools that allow them to fulfill this responsibility? So another question maybe. Who today in the audience has electronic access to their health records? Wow. And who can communicate electronically with their healthcare providers? Wow. Okay, who would like to? Yeah, it's not rocket science, is it? Well, Cowichan Tribes, in partnership with Canada Health Infoway and McKesson Canada, and leveraging the Relay Health tool, have developed the Mestima Citizen Health Portal. What this allows is for community members in Cowichan Tribes today, this isn't theory, this is happening right now, to access their health records electronically, to contribute to them, and to interact electronically with their providers in the health center. In addition, those providers can send information to the portal that they're documenting in their clinical information systems, and conveniently, the physicians in the local environment can do the same, enhancing a continuity of care model where information is flowing between the providers and the patient is at the center of the circle of care. There's also a stream of laboratory and pathology results coming from Life Labs into the portal. What this has essentially done is implement a care model where the patient is front and center. The patient is involved in decision-making, there's secure online messaging between providers and the patient, and there is a circle of care that extends beyond one facility. It allows providers that constitute that circle of care, even if they're in different practices, to communicate for the benefit of that patient. What we're hoping is that as this technology, as this model spreads and scales to other First Nations, which it is doing now, that you'll start to see more positive news in the environment about how First Nations are perhaps transforming some of the thinking about patient access and circle of care models, and being always mindful of the teachings of the elders and Cowichan Tribes. Having gained experience in this area, we are always happy to share what we know in the hopes that, in fact, this model could spread to the rest of our healthcare system. Thank you.